I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. Women, listen up. Is your menstrual cycle changing or becoming irregular? Are your emotions all over the place? Do you feel exhausted yet struggle to sleep at night? Do hot flashes suddenly overtake you even on the chilliest of Wisconsin days? Do you feel distracted and struggle to concentrate? Is it harder than ever to maintain your weight? Are you experiencing joint pain or muscle aches? If you've answered yes to several or all of these questions, you might be experiencing perimenopause. In honor of Women's Health Week, this episode of Health Inspired Talk looks at perimenopause and menopause. Our guests today will discuss what to expect during this phase of life and share ideas for getting help and relief. In our first segment today, Dr. Mindy Frimodig is joining us to talk about what some women might experience. Dr. Frimodig, thanks for being with us.
Thank you for having me.
So before we get started, can you help us define what perimenopause and menopause are, and maybe some age ranges of, when commonly women go through this?
So perimenopause, or otherwise sometimes referred to as the menopausal transition, it's the 2 to 10 year window at the end of a woman's reproductive life cycle where their hormones are going all over the place. It's that we call it the predictably unpredictable time in a woman's life. It leads up to menopause. Menopause itself is really just one day. It is the day 12 months after their last menstrual period at the end of a reproductive cycle. And every time after that is really postmenopausal. Average age is 51 of women in America that are enter menopause.
That's what I was going to ask. So, but this is a pretty wide range of ages that this could affect people.
It's a huge range. So if the average age is 51, and perimenopause can be 2 to 10 years. You have women who go into menopause at 48, 45. So it really can start in their 30s, and it can even start in their 50s later on. It's a very wide range, and it can be a lot of years.
Good for us to start with that definition so we know. This is leading to a lot of conversations. Some of it is actually pretty funny conversations that we are having now as women. We're going to show you some videos that illustrate some common perimenopause symptoms and experiences, and we're hoping that you can share your thoughts with us.
Okay.
All right, let's take a look at the videos.
Menopause sucks.
Yes.
Your body spends decades growing and taking care of life, and then Mother Nature thanks you with hot flashes and mood swings.
Okay, everyone, big day. Let's make sure we're all here. Unexplained rage? I am right here! Random crying spells.
I just watched this video of this military mom who flew home to surprise her son at graduation.
Okay, where is the metabolism? She hasn't been here in 10 years. That's why I showed up. Packing on the midsection in real weird ways. Panic?
I was so worried you weren't going to call me. That was a close one, huh?
It's a rare condition this day and age to read it.
These are dark times, John.
Those videos are great, and they speak to what it's really like.
It's important that we're having these conversations, right? And just making this a normal conversation that we have.
Oh, very much. Absolutely. Yeah. I have women come in all the time and they'll say, I think I'm losing my mind. My family cannot stand to be around me anymore. I think I have dementia. It's just such a broad range of things that, we need to be better informed and be able to treat them.
And feel confident in having those open conversations with our care teams, right?
Yes, absolutely. Yeah, and there are those complaints that people don't bring up unless you ask. Yeah.
Absolutely. So sleep becomes an issue a lot for women. They experience night sweats, insomnia. How do we help cope with that?
Oh, sleep is a big issue with this. And it's hard because it can be impacted by multiple things. It can be the hot flashes, which nobody can sleep good through hot flashes. So, that can be addressed with hormone therapy. There's also non-hormone therapies we can use. But it also can be impacted by anxiety, by worry in general. And there's actually a higher risk of sleep apnea developing in this range for women. And women in that perimenopausal range, when they develop sleep apnea, they don't look like typical sleep apnea. They don't have the big neck, the obesity. They don't have the heavy snoring often. It's just this insomnia, fatigue. And if we don't know that that's a possible risk in that range, we don't think about it.
That's a good point. We saw a lot about emotional changes. Why does this happen and how do we cope?
Estrogen and progesterone, right there, are female reproductive hormones. They are the whole window of perimenopause. It's defined by those levels being all over the place. They can change day to day, hour to hour. And the more we learn is that there are estrogen and progesterone receptors, especially estrogen, in all the tissues of the body. The brain, the heart, the muscles, the joints, the ovaries, the uterus, the salivary gland. So it really affects the whole body. The brain, the estrogen and progesterone receptors up there, when those levels are fluctuating all over, it really impacts mood. So that's part of it. It's also that sort of, right, the timing of perimenopause is it's that middle place in life. I mean, you often have teenagers or little kids of your own, and then you have aging parents, and you're at the peak of a career maybe. There's just so many life responsibilities, and then you throw in these wackadoodle hormone levels, and it's just, it's hard.
I think so many women can agree that that is what they're experiencing, right?
Yeah. And there they talk about ingest, but it's a real problem. I mean, about 15 to 20% of women are given a new diagnosis of depression in those perimenopausal years. If you've had a history of depression, like postpartum depression, maybe it is about 2 to 4 times higher. The highest risk for suicide in women in their life is in those perimenopausal years. It's about 7-fold increase in those years. So it's real.
Yeah. Absolutely. So as we are struggling maybe with perimenopause symptoms, how do we get help?
So you need to find a doctor or provider who is familiar with how to treat this and what to expect. If you go to your primary care provider or your OBGYN and they don't listen, it's not out of malice.
Sure.
It's just not an area they've focused on or understand, and you just need to keep looking. Maybe ask them if they know of any of their colleagues or partners.
And that's okay to do, right?
It is, absolutely. You need to advocate for yourself in this, for sure. And it's hard because so many of the symptoms, like you mentioned, all those body tissues, so many of the symptoms of perimenopause can be so many other things.
As women reach menopause, do their risks for certain disease and conditions increase?
They do, and we've known that for a long time. So increased risk of cardiovascular disease, heart attacks, strokes, coronary artery disease, increased risk of osteoporosis leading to hip fractures, increased cancer risks, increased risk of recurrent UTIs from genitourinary dryness, vaginal dryness. Those are actually big issues, especially as women age, leading to even hospitalizations from all these UTIs. So it's real. And it's really important that they understand in the perimenopausal time period, because what we now know, treatment of these symptoms of menopause, it's really time dependent. If we start hormone replacement therapy, if it's indicated, or menopausal hormone therapy, at a later age, those risks of cardiovascular disease, of stroke, they actually increase. However, what we know when looking at the data from the WHI study, if we start hormones in that first 10 years after menopause or before 60, it actually decreases cardiovascular risk. It decreases all-cause mortality. It decreases hip fractures. It decreases risk of colon cancer. So it's beneficial. But if you're not thinking about it to go in and talk about your symptoms early, you might miss that window.
So just being aware, having the open conversations with your provider, those things are critical.
It is. And so that's where it's really important to keep up with regular wellness visits, going in to see your primary care provider, talk about your cancer screenings that you should be doing, what are the lifestyle changes you can be making to decrease those cardiovascular risks.
Okay. Dr. Frimodig, this has been incredible information. We really appreciate you being with us.
Thank you.
The transition to menopause can come with more than just hot flashes and irregular cycles, so let's talk about it. Our next segment is Ask Me Anything. Our expert today is Jessie Schnell, a nurse practitioner with ThedaCare Behavioral Health. Jessie, thanks for being with us.
Absolutely, I'm happy to be here.
So you're going to talk through some of the emotional symptoms that women might experience, and we're hoping that you can maybe give us some tips and advice to help us deal with those things.
Sure, absolutely.
Okay, let's take a look at the first one here. Is there a connection between perimenopause and increased risk of developing new mental health conditions?
There absolutely is. So in perimenopause, what happens is that your hormones shift. So things like estrogen, progesterone, testosterone even are changing and they're fluctuating. So that can lead to mood symptoms such as depression, sadness, things like that.
So things that we should just kind of monitor, maybe even hyper monitor, right, during that time?
Yes, absolutely.
Okay. Why do I cry so easily now? Is this an everyday sadness or just perimenopausal depression? Why does that happen?
So I think it's important to be aware of whether or not it is maybe something that's happening every day, and maybe it's just a regular depression versus a perimenopausal depression. However, in perimenopause, it can cause symptoms of depression and make you feel more easily tearful and sad, and part of that is related to those hormone fluctuations.
So some of it might be normal.
Yes.
Okay. I feel like a different person, moody, anxious, even hopeless at times. Are those types of feelings normal?
Yes, actually, the American College of Obstetricians and Gynecologists say that common mood symptoms in perimenopause are things like irritability, sadness, anger, sudden onset of rage, things like that.
Again, things that we might be all experiencing that may not feel like they're okay, but they are.
Yes.
Okay. Next one here. Sleep is sometimes a struggle. What can I do if I'm exhausted, but I cannot sleep?
So the first thing you can do is make sure that you have really good sleep hygiene. So some of the things that we recommend, even from a mental health standpoint, are things like making sure you're keeping a normal bedtime routine, making sure that you're not on your phone or have a television in your room because the blue light actually keeps you awake, making sure that you're not eating or drinking too close to bedtime because then your body's trying to digest and not trying to rest. And the other thing that we say to avoid is substances like alcohol or things like that close to bedtime because they don't actually help your brain shut off and get rest. Even though they can make you tired, your brain is still moving. So I would definitely recommend having that good sleep hygiene first. And after you do that, if you're still having struggles, then it's a good idea to talk to your healthcare provider about things that could help in addition, like supplements or prescription medications.
Oh, those are all really good tips. Next one, I'm really struggling with my emotions and sometimes I feel like my symptoms are ignored. How do I advocate for myself?
The best way to advocate for yourself is to make the people that you're talking to aware of your symptoms. So the best place to start is usually your primary care provider. Make sure that they're hearing you and hearing your concerns and really taking the time to understand what you're looking for and the questions that you need to have answered. I always recommend writing down your questions as you think of them because otherwise you forget them when you go in by your doctor. If you feel like your primary care provider maybe isn't understanding what you need or doesn't have the knowledge you're looking for, then I would recommend going to someone like an OB/GYN because they really specialize in the hormone piece with menopause and perimenopause.
All right, these are wonderful insights. Thank you so much for your expertise and your recommendations. We appreciate it.
Yeah, absolutely.
And thank you for joining us. If you're a woman going through perimenopause or menopause, know that you are not alone. Our teams are here to help you and connect you to additional support when needed. You can visit our provider directory on ThedaCare.org to find a primary care or behavioral health provider. We'll see you next time. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.